Cirrhosis is a serious condition marked by liver tissue scarring, impairing its function and causing health complications. Many factors contribute. Chronic hepatitis C, HCV. Prolonged HCV infection triggers inflammation and scarring, leading to cirrhosis. Chronic alcohol abuse. Long-term excessive alcohol consumption directly damages liver cells, provoking inflammation and scarring. Non-alcoholic fatty liver disease, NAFLD. Often linked to obesity and metabolic syndrome. NAFLD advances by accumulating fat and causing inflammation. Chronic hepatitis B, HBV. Ongoing HBV infection induces liver inflammation, eventually causing cirrhosis. Autoimmune liver diseases. Autoimmune hepatitis and primary biliary cirrhosis provoke the immune system, resulting in inflammation and cirrhosis over time. Cystic fibrosis. A genetic disorder causing mucus buildup in liver ducts, ultimately leading to liver damage and cirrhosis. Iron buildup, hemochromatosis. Inherited disorders like hemochromatosis cause excessive iron absorption, leading to cirrhosis. Bile duct diseases. Conditions like primary sclerosing cholangitis and primary biliary cirrhosis impact bile ducts, causing liver inflammation and cirrhosis. Prescription medications and toxins. Long-term exposure to certain drugs, toxins, or infections can damage the liver. Other factors. Rare genetic conditions, heart disease, and unidentified liver diseases can also lead to cirrhosis. Cirrhosis typically progresses slowly, with symptoms emerging late. Timely diagnosis and addressing underlying causes are essential to prevent complications. Early intervention, lifestyle changes, and medical treatments manage cirrhosis and enhance overall liver health. Understanding cirrhosis. A deep dive into causes and consequences. Cirrhosis is a serious liver condition characterized by extensive scarring of liver tissue. This scarring, also known as fibrosis, can result in a significant decline in liver function, leading to a wide range of health complications. Cirrhosis often develops slowly, and its symptoms may not become apparent until the liver damage is quite advanced. Therefore, it is crucial to diagnose and manage the underlying causes of cirrhosis to prevent further liver damage and related complications. Early intervention, lifestyle modifications, and medical treatments play a vital role in managing cirrhosis and improving overall liver health. Exploring the causes of cirrhosis. Cirrhosis can be attributed to various factors and underlying liver diseases, each with its distinct mechanism of causing liver damage and scarring. Here are some of the primary contributors to the development of cirrhosis. 1. Chronic hepatitis C, HCV. One of the leading causes of cirrhosis is chronic infection with the hepatitis C virus, HCV. Over time, the persistent inflammation triggered by HCV can result in significant liver damage and scarring, eventually leading to cirrhosis. 2. Chronic alcohol abuse. Long-term and excessive alcohol consumption is a significant risk factor for cirrhosis. Alcohol has a direct toxic effect on liver cells, leading to inflammation and the formation of scar tissue. This can progressively impair liver function, ultimately culminating in cirrhosis. 3. Non-alcoholic fatty liver disease, NAFLD. NAFLD is often associated with obesity and metabolic syndrome. It involves the accumulation of excess fat in liver cells, a condition known as hepatic steatosis. Over time, this fat buildup can lead to inflammation and liver cell injury, contributing to the development of cirrhosis. 4. Chronic hepatitis B, HBV. Chronic infection with the hepatitis B virus, HBV, can also lead to cirrhosis. HBV can cause ongoing liver inflammation, which, if left untreated, can result in liver damage and scarring over an extended period. 5. Autoimmune liver diseases. Certain autoimmune conditions, such as autoimmune hepatitis and primary biliary cirrhosis, can trigger the immune system to erroneously attack liver cells. This autoimmune response causes chronic inflammation in the liver, ultimately leading to cirrhosis if not properly managed. 6. Cystic fibrosis. Cystic fibrosis, a genetic disorder, affects various organs, including the liver. In the context of the liver, this condition leads to the buildup of thick mucus in the ducts, obstructing the normal flow of bile and other fluids. Over time, this can result in liver damage and cirrhosis. 7. Iron buildup, hemochromatosis. Hemochromatosis is an inherited disorder that disrupts the body's regulation of iron absorption. As a result, excessive iron accumulates in various organs, including the liver. This iron buildup in the liver can lead to inflammation, fibrosis, and cirrhosis. 8. Bile duct diseases. Conditions such as primary sclerosing cholangitis and primary biliary cirrhosis affect the bile ducts within the liver. These diseases cause chronic inflammation and damage to the bile ducts, eventually leading to cirrhosis if not effectively managed. 9. Prescription medications and toxins. In some cases, long-term exposure to specific prescription medications, environmental toxins, or infections can contribute to liver damage and cirrhosis. These factors can induce chronic inflammation and scarring in the liver, impairing its function over time. 10. Other factors. Additionally, several other factors, including rare genetic conditions, heart disease, and liver diseases of unknown origin, can also lead to the development of cirrhosis. While less common, these factors underscore the complexity of cirrhosis and the importance of a comprehensive approach to its diagnosis and management. Recognizing the challenge of early detection. One of the distinctive challenges associated with cirrhosis is that it often develops slowly and insidiously. In many cases, individuals may not experience noticeable symptoms until the liver damage is already significant. As a result, cirrhosis is sometimes referred to as a silent condition, as its detrimental effects may remain concealed until the disease has reached an advanced stage. The imperative of early diagnosis and management. Given the insidious nature of cirrhosis, early diagnosis and intervention are paramount to effectively manage the condition and mitigate its impact on overall health. Timely identification of cirrhosis can enable healthcare professionals to initiate appropriate treatments, address underlying causes, and implement strategies to slow or halt the progression of the disease. The role of diagnostic tools. Diagnosing cirrhosis typically involves a combination of medical assessments and diagnostic tests. Healthcare providers rely on the following tools to evaluate the extent of liver damage and determine the underlying causes. 1. Medical history. Gathering a comprehensive medical history is often the first step in diagnosing cirrhosis. This includes assessing risk factors such as alcohol consumption, hepatitis infections, and family medical history. 2. Physical examination. A physical examination can reveal signs and symptoms associated with cirrhosis, such as abdominal swelling, ascites, jaundice, yellowing of the skin and eyes, abdominal pain, and changes in mental alertness. 3. Blood tests. Blood tests are a valuable diagnostic tool for evaluating liver function and assessing liver enzymes, such as alanine aminotransferase, ALT, and aspartate aminotransferase, AST. Abnormal levels of these enzymes can indicate liver damage. 4. Imaging studies. Various imaging techniques, such as ultrasound, computed tomography, CORT, scans, and magnetic resonance imaging, MRI, can provide detailed images of the liver. These imaging studies can help identify liver scarring and assess the extent of liver damage. 5. Liver biopsy. In some cases, a liver biopsy may be necessary to confirm the diagnosis of cirrhosis. During a liver biopsy, a small sample of liver tissue is collected and examined under a microscope to assess the degree of scarring and inflammation, preventing further liver damage. Once cirrhosis is diagnosed, it is essential to address the underlying causes and implement strategies to prevent further liver damage. The specific approach to management may vary depending on the individual's unique circumstances and the severity of the cirrhosis. However, several key components of cirrhosis management include: 1. Treating underlying conditions. For individuals with hepatitis infections, HCV or HBV, antiviral medications may be prescribed to manage the viral infection and reduce liver inflammation. Similarly, individuals with autoimmune liver diseases may receive immunosuppressive medications to modulate the immune response. 2. Alcohol abstinence. For individuals with alcoholic liver disease, the most effective way to halt liver damage and potentially reverse some early-stage scarring is to abstain from alcohol entirely. 3. Lifestyle modifications. In cases where non-alcoholic fatty liver disease, NAFLD, is a contributing factor, lifestyle changes are crucial. These changes may include adopting a healthier diet, engaging in regular physical activity, and managing conditions such as obesity and diabetes. 4. Symptom management. Addressing the symptoms and complications of cirrhosis is essential. This may involve managing ascites, fluid accumulation in the abdomen, treating hepatic encephalopathy, a decline in brain function due to liver dysfunction, and providing support for complications like variceal bleeding. 5. Liver transplantation. In advanced cases of cirrhosis where liver function is severely compromised, liver transplantation may be considered. A liver transplant involves surgically replacing the damaged liver with a healthy donor liver. Living with cirrhosis, navigating challenges and optimizing health. Living with cirrhosis can present various challenges, but it is possible to lead a fulfilling life with the condition. To maximize quality of life and well-being, individuals with cirrhosis and their healthcare teams can collaborate on the following aspects. 1. Dietary guidelines. Maintaining a balanced diet that is low in sodium and easy on the liver can help manage cirrhosis and related complications. Limiting salt intake is crucial in reducing fluid retention and managing ascites. 2. Exercise and physical activity. Engaging in regular physical activity, under the guidance of a healthcare provider, can have several benefits for individuals with cirrhosis. Exercise can help improve muscle strength, maintain a healthy weight, and enhance overall well-being. 3. Coping strategies. Living with a chronic condition like cirrhosis can be emotionally challenging. Support from mental health professionals and support groups can provide valuable coping strategies and emotional support. 4. Medication management. Adhering to prescribed medications and regular medical appointments is crucial for managing cirrhosis effectively. 5. Avoiding harmful substances. Individuals with cirrhosis should refrain from consuming alcohol and be cautious about potential exposure to liver-damaging substances, including certain medications and toxins. Looking ahead, a complex journey. Cirrhosis of the liver is a complex medical condition with a multitude of underlying causes and potential complications. Understanding the factors that contribute to its development and its impact on liver function is crucial for both healthcare professionals and individuals affected by the condition. With early diagnosis, appropriate management, and a comprehensive approach to care, it is possible to navigate the challenges associated with cirrhosis and work toward optimizing liver health and overall well-being.